like to call to order the meeting of the Health and Human Services Finance and Policy Committee. It is Thursday, February 26th, 2026, and we are needing one more member before we have a quorum. We don't need a quorum for the beginning part of this meeting. I will try to remember to let you know when we do have a quorum present. We will need that for bills later. Members, we have presentations for the first portion of this hearing today. We have a presentation from the OLA and from Department of Human Services, and then an update from Department of Human Services on implemented program integrity. And then we have 4 bills that are on the agenda, and my goal is that we get to the bills by starting at about 10 o'clock, and then we should be able to get through those 4 bills. So first on our agenda, we have a presentation from the Office of the Legislative Auditor. Welcome to the committee, Auditor Randall, and welcome, and please go ahead and you can state your name for the record and begin.
Thank you, Madam Chair and members. For the record, my name is Judy Randall, Legislative Auditor, and I just want to say thank you for taking time this morning to hear our report on the Behavioral Health Administration's oversight of grants. I'm going to turn to Ms. Lyson, who's our Deputy Legislative Auditor for the Financial Audit Division, to walk through the presentation. And of course, we're happy to answer any questions you have. Thank you.
Thank you, and welcome to the committee. And if you can please state your name for the record and you can begin.
Thank you, Madam Chair and members. For the record, my name is Lori Lyson. I'm the Deputy Legislative Auditor for the Financial Audit Division. Today I'm going to talk about our performance audit of the Department of Human Services Behavioral Health Administration grants that was conducted by our Financial Audit Division. We released this report on January 6th. The objectives of our audit were to determine whether the Behavioral Health Administration, which I'll refer to as BHA going forward, if they administered its grants in compliance with applicable requirements, did they establish an environment with effective internal controls, and did they provide grant managers with appropriate training? Our audit scope was grant activity that took place between July 2022 and December of 2024. And we focused our audits on grants of non-governmental organizations. So the Behavioral Health Administration administers grants to provide prevention, treatment, and recovery services for individuals with mental health conditions or substance use disorders. During our audit period, BHA spent $425 million on these behavioral health grants, including almost $192 million on non-governmental organizations. And again, that's the population that we focused on. These agreements during the same 2.5 period of time, BHA managed approximately 830 grant agreements, and that includes 590 grant agreements with non-governmental organizations. The areas that we tested were the request for proposals, single source grants, grant agreements and their amendments, payments, monitoring requirements, and closeout evaluations. We also conducted a survey of all BHA employees to understand the control environment within the administration and how well BHA trained their employees to do their job as grant managers. Based on our testing, we determined that BHA did not comply with most criteria that we tested, and our report contains 13 findings, including 4 findings, repeat findings from our report that was released in 2021. In the next several slides, I'm going to briefly present most of those findings. So per state policy, agencies are required to award grants through a competitive bid process as much as possible. Single source grants are used when an agency awards a grant to an organization without soliciting multiple bids. To do this, agencies must document the reason why that entity is the only one that can meet the grant's purpose. If there is more than one entity that can meet the grant's purpose, an agency must use the competitive bid process. What we found was that BHA did not comply with the single source grant requirements for 15 out of 24 grants that we tested. For 14 of these grants, BHA did not solicit multiple bids. They inappropriately bypassed the competitive bid process and awarded grants to multiple entities using the single source grant process. And they paid $4.6 million to these grantees when other entities could have provided grant-related services. For the remaining one grant, BHA awarded $1.6 million to this grantee, but did not clearly document the reason why this organization was the only one that could meet the grant's purpose. We also took a look at payments, and we found multiple issues with those payments. So BHA paid over $915,000 to 6 grantees for work completed before BHA finalized grant agreements. And per state policy, grantees should not be paid for work that is performed before a contract is executed. We also found that BHA overpaid almost $42,000 to 2 grantees for work that was not performed. And neither BHA or the grantees were aware of these issues until we brought it to their attention. And then BHA also bypassed the competitive grant award process for the mental health provider supervision program, and it gave $2.5 million to 13 grantees with whom BHA already had existing grants for a similar program. These 13 grantees are different than those that I talked about on the previous slide. We also found significant noncompliance with grant monitoring requirements, and I'm going to discuss those over the next several slides. So per state policy, state agencies should not pay grantees with past due progress reports. And what we found was that BHA paid over $13 million to grantees with missing or past due reports. And that was for 27 of 51 grants that we tested. State policy also requires at least one monitoring visit for grants between $50,000 and $250,000, and annual visits for any grants over $250,000. We reviewed 55 grant agreements to 18 grantees and determined that BHA should have conducted 67 monitoring visits. However, BHA could not demonstrate that it performed 27 of those 67 visits. So as a result, we decided to conduct our own site visits. We visited 8 grantees and 2 subcontractors, and we had serious concerns with one grantee and its 2 subcontractors. During the audit scope, BHA awarded 2 grants to this grantee. And when we went on site to both the grantee and its 2 subcontractors, we were not able to determine if the grantee or the subcontractors provided grant-funded services. For one of the 2 grants, the grantee received $1.6 million, and we questioned an unusually large first payment that was for $672,000 for a single month of work. We requested support from the grantee and its subcontractors, such as detailed invoices and participant data. However, the invoices we did receive were not clear, and then we could not determine how they developed the payment rates for different types of services. We looked at the grant contract, and we didn't see any rates contained in the grant contracts. And then we talked to both the grantee and the subcontractors, and they were not able to clearly explain the rates. So this one grantee, we, like I said, visited the 2 subcontractors, but they also had an additional 12 subcontractors, so 14 subcontractors in total. And what we saw here is that each of those 14 in that first payment received exactly $40,000. However, each provider provided a different type and quantity of service. The grant manager who authorized that first payment left the Department of Human Services a few days later, and at a subsequent time after they left the Department of Human Services, they became a consultant for the grantee, providing grant-relating consulting services. The subcontractors told us that they were not told that they needed that they were required to keep documentation. And when we talked to BHA, they weren't able to explain that first large payment and why that occurred. So state policy also requires agencies to conduct a financial reconciliation of a grantee's expenses at least one time before, or for grants over $50,000, and then at least one time before making a final payment to the grantee. That financial reconciliation includes a comparison of the reimbursement request to any supporting documentation. So you can look at payroll docs, you can look at bank statements, invoices, receipts. So what we saw here is that there was incomplete financial reconciliations for 63 of 71 that we tested. For 25 of those, we saw no documentation. For 37 of those, there was limited documentation. And for the remaining 2, the reconciliations were completed after final payment. And for one of the 2, it occurred 221 days after final payment was made. So with limited to no documentation, we were not able to test the accuracy and completeness over those reconciliations. And as a result, we decided to conduct our own financial reconciliations. And what we saw here is that we had issues with 11 of 18 grantees that we tested, and we questioned $296,000 of those payments, which is about 10% of the amount that we tested. And we saw that there were unsupported costs in reimbursements, there were errors in the reimbursement request, and there were at times no dates of services or any information on who received the services. And if you look in our report on pages 28 and 29, we get into more specific details on what those issues were that we saw. So state policy also requires state agencies to consider a grant applicant's past performance before granting any subsequent grants. And to facilitate the review of a grant applicant's past performance, state agencies must complete an evaluation that captures certain information, such as compliance with grant requirements, the grant outcomes, and also concerns about fraud, waste, and abuse. And then effective on April 1st of 2024, the Office of Grants Management revised its policy to require agencies to complete these closeout evaluations within 60 days of completing all grant requirements. So we tested 70 grant agreements and identified issues related to closeouts for 58 of those. For the first 26, these were not subject to that 60-day requirement. However, for 26 of those, they weren't completed until after we requested the information. And when we looked in the system, some of those were backdated. And then for another 28 that were subject to the 60-day requirement, they were late. From 10 of those were late at least 200 days past that final payment. And then for the remaining 4, there was no documentation. So in 2024, the legislature appropriated approximately $100 million in payments, not grants, to 2 organizations to provide specific mental health related services. And on this slide, we show an example of the appropriation language for the $1.5 million payment to one organization. As these payments were not specifically called grants in the language, BHA did not treat these as grants, and these payments were not subject to oversight policies from the Office of Grants Management. So our recommendation here is that the legislature should decide whether it wants entities that receive payments to be subject to those Office of Grant Management policies, or if not, identify the type of oversight it expects from BHA. So given the issues we identified with the BHA grants, we decided to take a deeper look at the culture within BHA, and we wanted to assess whether grant managers felt that they received adequate training to perform monitoring tasks. So we issued a survey to 196 employees, and we received an 86% response rate. So while most survey respondents did not indicate any ethical or legal concerns, staff did note concerns about other aspects of leadership. About a third of respondents disagreed that BHA leadership values employee input or shares relevant information in a timely manner. One staff member shared, executive leadership has repetitively shown staff that they won't take the staff's concerns or questions seriously until something serious happens or it makes the news. Many employees who indicated that they managed grants stated that they did not receive sufficient training. So 73% disagreed that they received sufficient training prior to managing grants, and 40% disagreed that they received sufficient training while managing these grants. And then of the 37 employees that identified that they conducted financial reconciliations, we asked if they understood how to appropriately complete those reconciliations. And what we saw was less than 20% indicated that they completely understood how to complete a financial reconciliation. So a summary of our recommendations are that we would like to see that BHA establish sufficient internal controls, conduct monitoring requirements, train employees, ensure supervisors oversee the work of those grant managers, and then rectify any issues identified in our audit. Thank you for your time this morning. Take any questions.
Thank you. And Ms. Randall, did you have any other comments right now? Okay. Members, do you have questions for Ms. Randall or Ms. Lyson? Senator Cran.
Thank you, Madam Chair. First off, Madam Chair, I do want to thank you for having this report heard before our committee. So many of them that don't shed a favorable light on our operations are not heard in the committees, only into the Legislative Audit Commission, so thank you. Madam Chair and Ms. Lyson, I'll focus on one. There's lots of areas, and I'm sure others have lots of questions. But in the one area in the one nonprofit, or thinking about site visits. And so some of the greatest challenges that we've had is we didn't even do the basics, right? We didn't drive by, do they exist, right? 27, you found no information for in your sample, 67 were selected in your sample. Many of them didn't have any documentation. Of the audits or the site visits they claim to have done, you didn't mention it, but I'm pretty sure those were virtual, correct?
Ms. Lyson.
Thank you, Madam Chair and Senator Cran. That is correct, that most of those were conducted in a way other than being on site, but there were some in the later period of time, I believe, that they started doing some on-site visits.
Thank you, Madam Chair.
Senator Cran.
And so with that, then you went out and the legislative auditor went out and selected 8 random audits then. And so from those 8 random audits, which you were very gracious, you gave them notice. I would not have, nor do I think we should have. And in that case, you went to 8 different sites. You went there for more than a few minutes, I believe, to request and try and find any information. And what type of activity did you see and observe? Because these are sites where they deliver those types of services mostly on site in those facilities. What type of activities and services have you seen within those sites while you were present?
Ms. Lyson.
Thank you, Madam Chair and Senator Cran. So there were site visits that we conducted, and you're right, we gave a 24-hour notice, but when we gave that notice, just to make sure everyone was aware that we didn't specify what grant we were looking at. A lot of these grantees had several grants with the Department of Human Services and the Behavioral Health Administration specifically. And so when we went on site, they weren't aware what we were going to ask for. So our expectation is that when we ask for that, we're going to see the activity in relation to that, and then we're going to see the documentation to support it, the reimbursements, payroll records, the participant data. And so sometimes we went on site, it was very clear, for instance, we would go on site and you could clearly see that there was kind of a warehouse function happening where they were doing something for other providers outside of that, and it was a busy hub of activity, and we can see that that was happening. The one that we went on that we had the serious concerns, and with the grantee and the 2 subcontractors, we tried to pick times where we knew that they were performing services, and we didn't see any services being provided. And then again, when we asked what those services were they located, what were those services, sometimes those services, they said, were conducted off-site, sometimes they were conducted there, but nothing was happening at the time. And then when we asked for information, they weren't able to provide us information in that moment. So a lot of it was just conversation upon visiting.
So, Madam
Senator
Chair,
Graham?
and I'll just make one comment. You guys, I'm sure, have lots of other questions with the failures we've seen here. So the one site that you then had challenges with is a $1.6 million grantee. And in that one, our Board of Behavioral Health and a manager in there, administration approved a $672,000 invoice. It was the very first month invoice with literally no information. In addition to that, then that manager quits and suddenly appears as a paid consultant for that nonprofit. The other 14 subcontractors in that one business each received $40,000, exactly $40,000, and their descriptions of services were vastly different, yet the rate and fee schedule was identical. So from the untrained person, it looks like it cut, copy, and paste, right? This just can't happen. And I think one of the people, you couldn't even find an address for whoever that was. And of course, those that you interviewed didn't know they even had to provide documentation to support or substantiate their billing. Madam Chair, these are gross failures at the lowest level. And for them, that was one that's kind of the most extreme. But all of it without doing the competitive grant processes, and we supersede all the basic checks and balances that we have in place. They just failed at a high level. And then you look back at 2019, that I think she's still employed just miraculously within the Department of Human Services, Behavioral Health, as Faye Bernstein was talking about these things. She was brave enough in 2019 to have that conversation. So she's still employed. She hasn't been terminated in that retaliation, but she's been neutered to meaningless positions and functions when it appears her expertise would have been very helpful in addressing these types of challenges all across the board. And so I'm sure many others have questions, but just to highlight those, and this is just a sample. And you look at the samples of the categories and you testified, and they fail between 50 and 88% of the samples in which you looked at. What were they doing? And so we've had this same scenario. We just keep hearing it over and over and over. And this was from 22 to 24, so it wasn't like it's a decade in the past, although we've had reports that were old as well that had similar issues. So again, Madam Chair, that's why I appreciate you having this. We normally just don't have these opportunities for people to get a deeper, in-depth view from the committees of responsibility. So thank you. And thank you, legislative auditors, for the work you do.
Thank you. Senator Kupek.
Thanks. First, I'm going to start with a comment, and then I'm going to kind of maybe piggyback off something Senator Coran brought up. But, we sit here in this committee, and people come to us, and sometimes this committee is a tough committee to listen to some of the stories and the needs of Minnesotans. And we as a legislature, we appropriate that money because we see a need and we see somebody that needs help. And it's troubling to me as the person that appropriates the funds to not see them used and to see those, basically, it's people did not get service here. And that's the real tragedy of this, is we know that there are people in need and they did not get service. And that's probably the most upsetting part of this. So to piggyback off of one thing that Senator Coran brought up, so we as legislators, we've put in some kind of rules for us about how when we leave this job, we cannot move into an area of lobbying. There has to be a little bit of a delay. So to kind of combat exactly maybe what we've seen here with somebody who put out a grant at DHS and then moved to that. So I don't know if you can answer this question, but is there legislatively, do you think we need to put something in place to prevent that sort of thing that we've inhibited upon ourselves from also doing in that respect?
Ms. Randall?
Thank you, Madam Chair and Senator Kupek. I will say there's currently nothing in law that would prohibit somebody from working on a grant, for example, and then going to work for the grantee. I know that there has been some interest expressed this session in putting something into law. I think the devil's in the details, certainly, but I think it's a standard independence, conflict of interest type of requirement that is certainly reasonable for a legislative discussion.
Senator Kupak.
Sure, and I guess, I would just say that I think the most important work too is we can do as legislators is make sure we have sunshine on processes and we're keeping things in check. So I don't know who wants to write that bill with me, but I'm on board with that. Thank you, Madam Chair.
Thank you. Senator Liskey.
Thank you, Madam Chair. And Senator Kupak, you brought into a subject that I'd like to work on with you is, I think even legislators, I've seen and heard some stories that there's sitting legislators that offer grants to programs for grants, and then they go and they work for a business that applies for those grants. So I think one could argue that they're violating our lobbyist laws, but of course they're not official lobbyists, so they're not. I'd like to see that come to an end as well, and I think that might be a loophole we need to work on together and close that on top of maybe executive branch employees that do the same thing. For a question that I wanted to ask specifically, I'm reading through the financial reconciliations. That's an 88, nearly 90% failure rate. Do you guys have the breakdowns of those that were no documentation, limited documentation, and then the reconciliations completed after? It's on page 12 or slide 12 on page 6 of the document we have in front of us. I'm just curious as to how much of that 90% or nearly 90% failure rate was to the point where it was extreme, no documentation, and then kind of what the breakdowns after that might be.
Ms. Lyson.
Thank you, Madam Chair and Senator Liskey. The breakdown is 25 of those reconciliations had no documentation. 37 of those had limited documentation, and then 2 of them were completed after final payment was made. So obviously there's a good portion of them that had no documentation, and then when there was limited documentation, it was just really tough to tell what was happening. So for instance, it could have been summarized data. It could have said, we want a reimbursement for $100,000 for providing mental health services, right? So there's no who are you serving, how many people are you serving, what is happening. So when we saw limited information, it was, maybe summarized, or it didn't have a complete view of what was all included in that reimbursement. So it was really hard for us to perform our testing, which is why we ended up conducting our own financial reconciliations.
Senator Liskey.
Thank you, Madam Chair. Madam Chair, and with this report, I'm seeing a lot of things that have always concerned me. When the government goes and hires somebody else to do the job that we are supposed to do as a government, we unfortunately are seeing pretty significant failures. And so if we're going to offer these programs, we should probably do that in-house and stop offering it as a grantee, because it seems people are taking advantage of the grant system. And so I'm concerned going through the grants as a program, and I'm worried about that. And so this just points to more reason to be worried about grants. Thank you.
Thank you. Senator Abler.
Well, thank you. And that I was going to say something else, but there's a lot of really good private vendors out there who do a really good job. And so, I'm not a big government guy, Senator Liskey. I think we should keep government smaller and spread it out to people that do good work. Just kidding. Anyway, so Madam Chair, I'd just be very brief. I appreciate this. Senator Hoffman, if he were here, his head would be exploding along with me. We discussed this in our committee many times. You were there, Senator Wickland, and we keep thinking that it's going to get better. And at one point I suggested we spin this off as its own agency so it can function in just the way that we all hoped it would. But just simply, as a department, when they're going to talk about something, are they going to respond to this as well when they comment?
Senator Abler, yes, that's the next, is Commissioner Gandhi who's going to present.
Well, thank you. Thank you for your work. And I don't know, the department means well, but it's just not working. So thank you.
Any other, I'm sorry, Senator Liskey?
Thank you, Madam Chair. I got to respond to Senator Abler for calling me out as some big government guy. I'm the guy that definitely does not vote for big government, in case anybody's ever curious and wants to look at my voting track record. No, I'm just implying that by the government employing people to do these things and then failing is the issue. I don't believe in bigger government by any stretch of the imagination. Thank you.
All right. Senator Kupak.
Sure, I mean, part of the thing is when we go to these nonprofits, most people who are working for nonprofits they're not making a lot of money at this as the employees that do that. And it is because as the government, it is a way that we kind of move this over into the nonprofit sector to get, in some ways, if they're doing the work at lesser, it is, in some ways more bang for our buck than if we hired state employees to do that work. So there is, when it is done right, it is a savings to the government that we do it this way.
All right. I don't have other specific questions except that I'm wondering, I mean, there are a lot of areas of concern I have about, things that it seems like we had legislative language in place to try and drive the behavior that we were looking for. And I'm wondering, I know that your office does a report, or has done for the last couple of years, like a follow-up on recommendations. Would this report, would the recommendations fall into that work you do afterwards to kind of follow up on things? Auditor Randall.
Thank you, Madam Chair, and thank you for the question. Yes, you're right. We've been doing these update reports now. We've done them twice, and now there's a law requiring them annually, so we will certainly be continuing to do them. And the findings in this report will be captured in there. We usually give agencies a year or two to give them some time to implement the recommendations before we then go back and do an in-depth dive to see if they've implemented the recommendations. But absolutely, you can be sure we will be going back and looking to see how BHA is doing going forward.
Okay, thank you.
Madam Chair, quick follow-up on your question. I do think one quick follow-up would be, and I agree with the waiting for the more comprehensive review, but one of the quick follows-up would be, of the site visits you did, I think there's a cause for an immediate review of what were the billing activities from those that you visited for the day you were there and observed little to no activity.
Ms. Lyson?
Thank you, Madam Chair and Senator Cran. I'm sorry, can you repeat the question?
Senator Cran.
Madam Chair, and Ms. Lysine, so of those site visits you did, of the 8 site visits, one you saw no activity. And so I believe to wait a year or two to go and re-examine those 8 sites that you visited to see what was billed on that day in which you were present for particular services, and analyze them. I believe that's due in the near future, just a quick cursory review, and then later follow up with the year or 2 year later. Thank you.
Ms. Lyson?
Thank you, Madam Chair and Senator Cran. Yeah, I agree. I mean, it seems that it would be helpful to take a look at that sooner than later. Thank you.
And Ms. Randall, I'm not sure. I'm thinking more a little bit higher level in your follow-up reports. I don't know whether your follow-ups include to that level of detail, or if you recommend that the departments do that kind of follow-up. But in any case, yeah, it does seem like follow-up should be more, should be sooner for some of the things, and some of the recommendations I can see waiting, a year or so to see how things are implemented. But thank you again for your time, and I really appreciate your presentation.
Thank you, Madam Chair. Thank you, members.
And I would like to have Commissioner Shireen Gandhi come forward. Welcome to the committee. And now I can call you Commissioner Gandhi rather than temporary commissioner. And I believe you have a presentation that Christie is going to get set up here.
Yeah.
Okay, there's some technical detail and
I'm plugged in. I'm plugged in with this. I think that's the audio. I don't have the Zoom link, but if you want to send it as an issue with the display,
It should be sent to you, otherwise I will have it sent to
do you want to look at the display? Do you want to look at the display settings? Is that, maybe you'll just try this. See if that works.
the Zoom link, which should be sent to you as option.
Okay.
Can go without it. I don't need it.
Do you want us to start without? Sure. But I'm gonna need it for the next one, so if I could get set up with the Zoom. Yep.
do you, do you want to go ahead? I mean, we have, members, you do have the handout in your, that was provided, like, as you came in today. It was one that wasn't in the packet. So Commissioner Gandhi, if you would like to begin, if you could state your name for the record and you can begin.
Good morning, Madam Chair. Thank you. My name is Shireen Gandhi, and I'm serving as Commissioner for the Minnesota Department of Human Services. I want to also thank Legislative Auditor for the important work that she and her team have done to review the department's grant processes. And I appreciate the value that audits bring, because by addressing the findings, DHS is making its internal controls stronger. Before I begin my remarks, I want to pick up with the last question that Senator Coran asked, and I believe it was referring to page 25 and that grantee that the legislative auditor was sharing, where they visited and those payments were made, and there was an employee that left DHS and 9 months later was employed by that grantee. And I wanted to just give this committee a little bit of background on what happened at DHS during this time period. There was a report from an employee to our internal audits division about concerns, and so the internal auditor brought those concerns to me. I was deputy commissioner at the time, and I asked him to immediately start an investigation into this matter. So our internal audits office investigated the issue and had many similar results as the OLA did. And so DHS completed its investigation, referred matters to the BCA for criminal investigation, and also the Attorney General's office is working to recoup those funds. So, getting back to my remarks, strong internal controls and processes for behavioral grants are absolutely critical to protect taxpayer dollars, to ensure the effective use of funds to promote behavioral health, which ultimately, as your members have shared, are about empowering families to engage in the methods of treatment and recovery that are meaningful to them. The need for the funds is significant, as communities statewide are experiencing mental health challenges and the nation continues to face an opioid epidemic. With respect to the audit report, while I'm very disappointed that DHS has findings, the OLA's report highlights the importance of the grant compliance work that has been underway at DHS, and DHS agrees with and will resolve all audit findings. We are using the findings as our roadmap for prioritizing our work to continue strengthening the oversight and integrity of the behavioral health grants. A quick word about the audit timing. Next one. Yeah. The OLA report, as Legislative Auditor Randall shared, covers July 2022 through December 2024, and that overlapped by 12 months with an earlier OLA report on state-funded grants from July 1 through July 30 of 2023. And the reason I mention this overlap is that that gave DHS was already working on the items discovered in the previous audit report. And so many of the improvements and systematic changes were in development or early phases during this audit. Next slide. One challenge we have at DHS is that strong internal controls require the right administrative complement to execute. So I think you saw the number of grants that the BHA is administering, and in-person site visits to 600, 700, 800, depending on the year, 900 grants that we're administering takes time and takes staff. The challenge at DHS is that with our administrative budget, it has been increasing, and not our administrative, our programmatic budget has been increasing, and our administrative budget is about 2 to 3%. And that is for staffing as well as IT systems. So that's a pretty thin operating budget there, and our grant dollars have increased over the past 5 years by 80%. And I know Tim O'Malley released a report this week, the next slide, and he highlighted how important it is in grant making to have appropriate administrative funding so that you can have strong internal controls to manage the funds going out. There's many other recommendations related to grants. I'm not going to spend time here going into them, but I respect the information he put together and think the recommendations are worth further consideration at the legislature as you look at grant making. In terms of resolved grant audit findings, I'm not going to spend too much time on these slides, but I know that if I don't include them and what we've done to resolve findings, then people are unaware of the progress we're making, and they focus on the open findings. So I just want to make clear that DHS has been leaning in to resolve the systemic issues within grant making and to both enhance policies, processes, procedures, internal controls to support our grant managers in doing a better job of managing grants in a very tough environment with a heavy workload. So these next two slides list where the DHS believes that it has resolved audit findings. Of course, we have to continue to test and make sure that the fixes that we make are working as intended. So it often takes a couple times to get it right. Following some of the findings, just to quickly list them that we've resolved, are following the OGM's RFP policy, having RFP reviewers complete conflicts of interest, including all requirements of RFP language in the grants themselves, proper scoring of RFPs, and advance payments to grantees. There's also other work that has been going on at the DHS in order to support better grant making. In 2023, very pleased that the legislature funded the creation of the Central Grants Office at DHS to provide oversight and continuous improvement support to the grant-making process. The Central Grants Office manages the contracts integration system to support grants through their life cycle, and they continue to enhance that, that database to support all of the steps that need to be made. It's probably at some point soon going to outgrow its usefulness, and we will need a more sophisticated grant-making technology, but it was what we were able to put in place at the time with the resources we had. DHS has also made changes to BHA. We have made leadership changes and restructured the way the department works. In August 2024, the division was elevated to an administration, and a dedicated assistant commissioner came on board in September of 2024, bringing executive-level focus and accountability to the grant-heavy administration. BHA has also added a dedicated compliance and contract manager to oversee grant administration. In Legislative Auditor's report on the BHA grants, I found two critical themes that were evident that need our continued focus attention. And what I'm going to say is not going to exactly track with the slides, because it's a lot. My response in the audit is 16 pages. It's in the back of the book, so I'm trying to summarize at a high level what we're doing. First, it was obvious to me in reading the report that there is a clear need for increased oversight and supervision of grant managers to ensure that they complete required functions on time and in compliance with all requirements. The supervisors serve as an essential control to verify that grant agreements are included in required elements, that amendments are timely, that payments are made only after proper authorization, progress reports are reviewed before payments are made, financial reconciliations are completed, monitoring visits are completed and properly documented, and that the grant closeout reports are completed within the required timeframes. And second, there is a need for adequate and comprehensive training for grant managers on grant management requirements, policies, procedures, both before they begin managing grants and as requirements evolve. Insufficient training leads to gaps in understanding of fundamental requirements such as statutory citations, competitive bidding processes, payment restrictions, progress reporting standards, and monitoring obligations. Much of this work is underway because of our efforts to close previous audit findings, but there is still more work to be done. The corrective action plan, I think that's a slide or two ahead.
I went the
Wrong
way,
direction.
sorry.
The corrective action plan is underway, and I think it's another slide ahead. And like I mentioned in the audit report, there's a audit finding by audit finding response of how we are going to close those findings, when we're going to close those findings, and who is ultimately responsible for ensuring that they are closed. All of these are going to be completed by the end of the year, with many of them being completed by mid-year. We are tracking all audit findings until completion. I also want to take a minute to thank our staff in the Behavioral Health Administration, not only for the work that they're doing to improve grant making, but also for their participation and review and candid feedback that they gave to Legislative Auditor Randall, as reflected in Finding 13. While a majority of staff did not raise concerns, I take to heart the sincere feedback shared by some staff that the concerns they raised were not addressed. It's critical that we foster an organizational culture built on trust, transparency, and accountability and open communication, and that we listen and address any questions or concerns that staff have. We are continuing to build a culture of compliance where all staff understand their responsibilities and feel they have the knowledge, skills, and authority to fulfill those responsibilities in accordance with the laws, policies, and professional standards. And this includes maintaining channels for staff to comfortably report concerns, ask questions, and seek guidance. Training slide. In terms of training, DHS has mandatory grants training, and the Office of Grants Management have mandatory grants training. And I am pleased to report that since I last presented to the Legislative Audit Commission in January, 100% of the BHA staff have completed all OGM trainings and DHS grant trainings. And the agency overall has a 99.7 completion rate for required grant trainings. Also, since the LAC presentation where I promised to make our grant contracts publicly available online, we now have a list of all grant contracts online, and we will be making the grant contracts themselves available online. It'll take us a couple months. We have almost 2,000 grants, but that work is well underway. And then lastly, I wanted to provide you with a status of the update of the documentation issue Legislative Auditor Randall brought to DHS's attention on December 18th, which was the day of our exit conference. And what she brought to our attention is that they encountered documentation issues where either documentation was created late, uploaded to our contracts integration system late, or potentially falsified. And I was shocked to hear this information at that hearing. It is unacceptable for any staff to provide anything other than accurate representation of work completed to auditors. And DHS swiftly and thoroughly began investigating the concerns raised, and we've been keeping the auditor updated on what we learn and any actions taken. So on the 18th, the OLA, back one slide. On the 18th, the OLA notified us. In the evening of the 18th, Legislative Auditor Randall and Ms. Lyson very graciously agreed to meet with me immediately to discuss what they had found and to provide us documentation, which they shared with us on the next day. We immediately, working with our digital forensics lab, pulled electronic information widely from people that were potentially involved in this so that we could preserve any documentation. And we, as soon as we could, secured investigative resources to conduct an investigation. That was the day before Christmas Eve. Christmas Eve, we had an investigation plan in place, which had 2 phases: to investigate staff who were specifically identified as having possibly created falsified or backdated records, and to review supporting documentation of staff who uploaded information to the CIS late to determine whether that was a matter of the work was done but just uploaded late, or whether there was something different going on there, more serious. Next slide. Where we are now is the investigators have conducted, or back in December, let me go back a step, what the investigators did was to make sure they had a comprehensive understanding of grant oversight requirements and all the information in our database and metadata in all of the emails, home drives, and other data collected by our forensics team. The investigators conducted interviews with the subjects in January, and the final investigation reports were delivered to HR at the end of last week. And this week, HR is reviewing the reports, and we will discuss and take action based on what is in the reports. Phase 2, we are reviewing the records for that larger group of individuals to see whether documents were created after the request or uploaded to the CIS after the request to determine whether any action is appropriate. So in conclusion, I just want to share that I appreciate how the OLA and their findings and recommendations in the report continue to underscore how important compliance is and the compliance work underway at the department, and that it gives us a roadmap for how we will further strengthen our controls and achieve full compliance with the legal requirements.
Thank you very much. I appreciate your going into detail on some of the more significant aspects so that we can see the timeline and what is currently happening. Members, do you have questions? Senator Coran?
Thank you, Madam Chair. Commissioner Gandhi, I'll start with the last section first I'm glad you created the internal investigation in phase 1. I don't see anywhere in here where you went out to verify, because in kind of phase 2 is what worried me about the question is we're going to go out and verify whether, they just uploaded them later or had them and just didn't do their job and uploaded them. But I think there was a clear backdating of documentation, and then it was also verified that they went out to the grantees to collect the original information based on the information that was then subsequently either created or backdated. And so I don't see anywhere in here where the investigation included the verification of the grantee information that was submitted, or was that information already provided by the legislative auditor? Because I don't see it listed in here as that would be one element of the people you investigated, or as a part of the investigation.
Yeah.
Commissioner Gandhi?
Madam Chair, Senator Coran, thank you for the question. I want to be careful with any specifics because of our HR matters, but what I can share is that Legislative Auditor Randall, the Legislative Auditor's Office, gave us all of the information, and our investigation used all of that information and built upon it, and absolutely are taking into account the matters that you shared, that information was backdated and falsified.
Thank you, Madam Chair. There are so many areas here that, your entire presentation was, well, thank God the legislative auditor in a previously report told us we were failing at our job. And now it's the excuse for during this period that we failed at a pretty significant level across the board in so many different categories. And that's frustrating to me as a legislator. We will never be able to define in statute that you should just have great business practices across the board. That's not right. We leave the rules and the policy up to what we expect as the experts. And interestingly enough, right? I mean, it was you were in charge. You were the deputy commissioner, so you're very well aware that was your part of your responsibility. Now you're the commissioner, and it just every single report we have, we come back and say, well, we thank God they told us we're failing. And it's failing at the basic levels. We're not talking about if there was some sophisticated fraud or some attack on us. We're talking about really, really basic things. And so that's where I just get extraordinarily frustrated. We don't have time to go into a pile of questions because we got actual bills to hear, but that's the frustrating part we have. And then then I guess the only piece is you conflate RFPs with grantees. RFPs are very separate from grantee award processes, right? An RFP is a request for proposal, a purchase, where we have contracts, admin gets involved. Grantees, we have a different set of criteria and how we select them, who participates in the selection of those processes or the awards. And as we've identified, it's a very incestuous process. Who's worked in previous nonprofit, who's now is a part of the evaluation or creating the criteria. But I will bring up the one piece that I think kind of goes into the Senator Kupik and Abler and Mr. Big Government, Senator Liskey. We have, as a body, just have to review how we do this entire process. Every agent, now you're not the only agency that's failing in the grant process. It has no transparency. We have to really just figure out what services do we need? What have we determined? Because there's great need in any of the social ills and our disadvantage, all of those things. We have to decide that, yes, it's something we should solve or that we should invest in. We should fund it. But I'm telling you, we should just get rid of the entire grant methodology, relieve you of that burden, and move from, it'll shift the burden, but to a true request for proposal process. Every single person here that gets these grants, every 18 months, they're here begging for more money, and if they don't get it, they won't exist. So they can't staff appropriately and provide the highest level of service, right? And it's not working for you. It's not working for the nonprofit, and it sure in heck isn't working for the people we intend these dollars to serve at the highest level. And so I think we have to take a hard look. We can't have direct appropriations because we get no insight. But through the traditional procurement process, we would get the transparency we need, right? Relieve you of some of these things of this incestuous, or the grant award process and who participates, but really get it to an element that we have a procurement process that has service level agreements that are defined and measurable, because we can fire and terminate them at any point in that contract, and we can hire somebody else. But the people providing the services, in nonprofit, they're just private companies. They'll always do better in spite of government. And what it will do is it'll provide really comfort for them. We can have longer procurement cycles to enable them to invest and hire the actual right people that could do it, that will then be able to do a much better job, and will get more value for every dollar we put in when we decide to fund it and when we should. So I just would love you guys to come to the table and support those types of efforts as we move forward. I know you get placed with burdens, but we cannot be the position, even the burden we place upon you, tell you that you should do a great job. We expect you to hire the best and the brightest, and we expect basic things to be done at the highest level. So thank you, Madam Chair. Again, thank you for having this.
Commissioner Gandhi, do you want to respond to any part of that? And then I've got 4 people on the list, so please go ahead if you have.
Madam Chair, Senator Cran, there's a lot there, and I would welcome a deeper conversation with you offline. I think in this space, it is unfortunate that critical, needed behavioral health services that are ongoing are being funded through grant making. It would be much more effective to have another approach for delivering these critical services. Grant making is better used for innovation, for trying new things, rather than sustained, mental health, behavioral health, substance use services.
All right, thank you. I have Senator Utke, then Fate, Kupek, and Liskey. So, and members, we do have, Ms. Graham has a presentation about program integrity that's been implemented. Would be nice to get through that and then move to our bills. But Senator Utke.
Thank you, Madam Chair. And, just a couple things here, because a lot's already been covered. But the fact that, it's in the report says that, previous findings hadn't been addressed. And then we get into what's a pretty horrible report. And actually, I was hoping for more. I want more details. This came out on January 6th. More specifics. I think it's lacking specifics, even though there is some here, and I appreciate that. But I would hope that the next time we hear about this, that we get a follow-up report, that we have more things in play. I want to see what's going to happen. I mean, in pretty much a month and a half, we should have had, and you had a heads up. I mean, I see things happening back in December already. I'm hoping for more. I want to see more, because there was a lot of major failures here. And unfortunately for the agency, this isn't the only bad report we've seen like this. We need to see change, and that's what I'm hoping to see in future hearings, that we have a chance to talk. To me, it was short on specifics. It was just kind of high level. And that's really, I'll let it end there, but, you know, I'm hoping to see more in the future because we want to make sure that this is kind of, we want to see these OLA reports like this come back with nice, you know, something that's complementary. And, you know, this has been the thing that we've seen for, I guess, my case, far too long. So thank you.
Commissioner Gandhi?
Madam Chair, Senator Utke, thank you for your question. And I have our Chief Compliance Officer and the AC and Deputy AC of BHA tracking these audit findings to conclusion in great detail. I would be happy to meet with you to share in depth what we are doing to close them. I take this very seriously. We are making multi-layered systemic changes in that administration so that these findings will be closed and will be sustainable. So I would be happy to provide you with that depth.
Thank you.
Thank you. Senator Fateh?
Thank you, Chair Wicklund, and thank you, Commissioner. I remember in the past, in Human Services Committee, that DHS requested funding for more FTEs. I think it was maybe 600, something like that, a few hundred FTEs, and there was money set aside for that. I guess what happened to those? Were they ever hired, or where are we at in the process with that?
Commissioner Gandhi? Just
Madam Chair, Senator Fateh, I'm unsure of which specific request you're speaking of. I can tell you generally in the grant-making space, we have had challenges with the increase in programmatic funding and our administrative funding not keeping up.
Senator Fateh?
Yeah, no, thank you so much. I guess within those hires, how many were set aside for this specific purpose is my question, because there were several hundred roles that were set aside, or FTEs.
For grant.
Commissioner Gandhi, maybe
Yeah.
do you want to get back to us on like staffing levels and where you still would perceive you have gaps?
Yeah. Madam Chair, Senator Fateh, yes. I'm not aware of that level of funding being dedicated to grant making, but we can go back and check on that.
Okay. Thank you. Senator Kupek?
Thank you, Madam Chair, and I'm not sure that, you know, this may be a personnel issue, and maybe you're not going to be able to answer this, but particularly, I think this is a question that comes from my constituents all the time, is like, so if there was somebody that kind of made a mistake, and particularly, I think with the backdating of these reports, that is clearly not a thing that you were supposed to do. What is going to potentially be a disciplinary action that happens to those people going forward? And I realize that this could be under investigation and you can't go into great detail, but, you know, even at a 10,000-foot level, maybe just an answer for that.
Commissioner Gandhi?
Madam Chair and Senator, thank you for that question. I will share, so that I don't get into any issues with investigations underway that I'm not allowed to talk about, I will share with you how I view things and what I would do hypothetically. Knowingly falsifying documents is, like I said, absolutely unacceptable. In the private sector, I would immediately fire somebody. That's, you know, without cause, let them go. At the state service, I think similar thing can happen. There are many administrative procedures that with labor represented employees, but I think something similar along that lines is appropriate as well. I also think it's important to look at through a safety science lens for not holding people accountable for things that are not their fault. So for example, if you give an employee an impossible task and your systems and your processes don't support them being able to do that task, that fault falls on the organization, not the employee. So I think you have to do a proper investigation to find out where the responsibility lies. but intentional wrongdoing is never acceptable.
Senator Kupak? No. Senator Liskey?
Thank you, Madam Chair, and I'd first like to thank Senator Coran over here for articulating the entire thought process I was trying to get across, which is that the grantee system is definitely what seems to be broken. I think an RFP system would be a much more appropriate. You have to apply, you have to get approved, and then work through it. And the contractors, if we give them a grant, once the grant's given, there's no accountability on the back end, and that's the thing that I think I'm having the most issues with. It seems like we fail to finish the reconciliation. That seems to be the number one argument. Director Grom, I think that was something that I've been working on with you over the interim, is that I have a constituent that's not even my own constituent, somebody in South Minneapolis, who reached out via one of my high school classmates, and she's falling through the cracks. She doesn't have housing, she doesn't have the personal care assistance that she needs, and she's getting evicted from a house that was given a grant to support her. And now we're finding out that she's being evicted. And she went to court to try and defend her house. And she's definitely somebody on disability, so she needs help. And we don't have an answer. And then we're finding out that her case manager that we've assigned to her isn't doing their job. And so I think government as a whole is failing, and we need to figure out why and where, and is the grant system part of the problem? And it sounds like it probably is. And I look forward to continuing to work with you on finding a solution for that individual. But if she's one individual, what's happening to the rest of the people in our state? And where are we at? And why is this failing? So, thank you.
Thank you. I don't see any other member questions. I don't know if you want to provide a response to that particular statement or just, and then any final thoughts if you'd like to share.
Madam Chair, Senator Liskey, I don't know if my colleague, Ms. Grom, wants to comment as well, but I will just state that housing is definitely an issue, and supportive housing for people with disabilities and needs. That's something that I think the state needs to look at broadly together with counties and other managed care organizations that do case management. It's definitely uneven across the state in terms of who's able to get services, how well they're supported by case managers, and we are working with our agency colleagues, Minnesota Housing, our Kathy Tenbrook at the Minnesota Interagency Council on Homelessness, to try to figure out a better path forward together with counties and others that are involved in this work. I don't know if you have anything to add.
Ms. Graham.
Madam Chair, Senator Liskey, I would agree with the commissioner's comments and just say that I think you're right that the human services system is in a pivotal moment. We're seeing increasingly sophisticated, fraud schemes. We're seeing workforce pressures at both state and county level. And whether it's grants or housing or oversight of, counties or managed care, I think we all need to take a step back and figure out what we need to do as a system moving forward to seal up the cracks and support people.
All right. Well, thank you, Commissioner Gandhi, for coming before us today. I really appreciate it. And I believe, Ms. Graham, you're going to do the program integrity presentation. If we have more questions, we'll definitely let you know, and look forward to continuing to work on these issues.
Thank you, Madam Chair. Appreciate the thoughtful discussion.
Thanks. And there is a handout, and the pages are delivering your handout, Ms. Graham.
Thank you, Madam Chair. I'll just pull up the slides.
And I'm not sure if you have a sense of timing for that, if you can maybe accelerate your progress through it, and then if we can briefly take any questions. Program integrity is definitely a topic that we will continue to spend time on. This was meant today. We wanted to have a way to convey kind of what has been done and what was done most recently in terms of program integrity proposals that passed in the past years. And so that's what this is meant to cover, new ideas and solutions. We definitely will be spending more time on that. I heard today that the governor is going to be releasing his program integrity package, or I don't know, maybe it's not called that, but the package that has items related to program integrity today. And so then we will have that information soon about what he's coming forward with. And we'll spend time on discussing that, I'm sure, as well. So, Ms. Graham, please state your name for the record, and if you can begin.
Thank you, Madam Chair. My name is Christy Grom, and I'm with the Department of Human Services. I'll jump right in and try to move quickly through the slides. Thank you for having us here today to talk about a little bit about the framework around program integrity, but also what was passed by recent legislatures and where the department's at with implementation. So I wanted to start by just giving the committee a very brief reminder that program integrity is a broad term. And oftentimes we hear conflation between maybe improper payments or waste or abuse and fraud. So when we think of program integrity, it's an umbrella term. Fraud is certainly within it, but it's much more holistic. So as a department, we're looking across the entire system. We're trying to understand, do we have the proper reimbursement methodologies in place? Are they sound? Are they incentivizing the service model that's set out in our state law and our federal authorities? Are there the appropriate regulations in place? Sometimes that means a license, sometimes it's a certification. It could be a variety of clinical requirements in place, but what do we have there to make sure that there's a framework that can keep the respective program held with integrity? Data analytics and surveillance is increasingly an important feature of what we need to do when we're thinking of program integrity, particularly prevention and detection. This often doesn't get talked about in the space of program integrity, but provider and member education, technical assistance is really important. Most providers are not looking to exploit the system. Most providers are not fraudsters. We know that there are a few bad apples and increasingly sophisticated rings of fraudsters out there. But when we bring on new providers, new grantees, for example, new providers in the Medicaid system, we need to really take responsibility for educating them, making sure, in part, they are running a business, but we want to make sure that we do our best effort to inform them of the rules and laws that this program that they're delivering services under are subject to. Provider credentialing and enrollment, and of course, detecting improper payments. Wanted to spend a little bit of time here today. I think members know this, but program integrity is critical for the Medicaid program. Ultimately, preventing and detecting fraud is what's going to help people who are relying on this core service. Medicaid, as we all know here, is a life-sustaining economic lifeline for millions of Americans across the nation, but also for over 1 million of our neighbors, friends, colleagues here in Minnesota. Medicaid is the single largest source of health care coverage in Minnesota. It's really the glue that's holding together a lot of our healthcare infrastructure here, supporting mental health payments, hospitals, home care, nursing homes, a lot of other provider types, and really making sure that uncompensated care is minimized. Importantly, I think it's important to know and to highlight that Medicaid is really important for greater Minnesota and the citizens who live there. So there's maps on some of our websites that many of you have seen, but it's not just the metro where Medicaid is important. It's greater Minnesota, in particular in the northwest region of Minnesota. We see a greater percentage of people using Medicaid than even in the metro. So important to keep the functionality in mind of just why we need to strengthen Medicaid. I'll get into all the details here. I wish I could, but I'll skip over some of those. So related to that theme, we're seeing right now, and we've known that we have to have strong program integrity controls in place in order to preserve these critical Medicaid programs. So Governor Walz has issued an executive order. DHS has initiated multiple administrative actions, some of which are highlighted on this slade, and don't have time to get into it today, but there are several CMS corrective action plans that the department has submitted over the past couple of months to CMS as we take fraud seriously and have really taken a proactive approach to dealing with cracks in the system. So just quickly noting that we've identified an additional swath of what is called high-risk provider types, or services, I should say, not providers. We've got a dashboard out there for the public to see. We've done audits of EIDBI services. We've done on-site visits. We've discontinued a housing stabilization program, which was a very painful step that the department would not have wanted to make, but had to make with regard to program integrity. We've got enhanced prepayment review that's occurring, and many other actions afoot at the department, including looking at reorganizing the department to figure out how we need to prioritize program integrity across the entire department and not have it just siloed in certain areas. As we've thought about program integrity at the department, we need to have a methodical approach, a planful approach. So we're really thinking through, when Commissioner Gandhi and Inspector General Clark came on, what are the key elements that we need to be aware of as we're rolling out all of our, and really highlighting, you know, the work that we've been doing for a while, but making new actions as well. So we're focusing on transparency, prevention, detection, and enforcement. When it comes to transparency, I think one thing that rings really true for us is that Medicaid oversight is a shared responsibility. Our human services system is administered by the Department of Human Services, or overseen by the Department of Human Services, but it's county administered in large part. We work with counties, we work with tribal nations, we work with managed care organizations, and of course we work with the legislature. So making sure that we're transparent whenever possible, whenever we're not compromising an investigation, is really an ideal that we hold fast. Over the past year, we've made some changes in this regard, and I'll talk about some of those as I move on to other slides. But I did just want to highlight that value, and I know there's ongoing discussion about transparency and how we can improve even more. Prevention is really key to what we do at the Department of Human Services. When Inspector General Clark came on, his mantra was really, please stop the fraud before it gets to me. Obviously, the Office of Inspector General has a really critical role in implementing administrative actions when it comes to credible allegations of fraud, investigating, turning off the money that's going out the door that appears to be fraudulent. But we need to make sure that we're putting more measures in place to prevent money from going out the door when we can. So historically, Medicaid programs and DHS in Minnesota was really focused on looking at recovery of misspent funds, sort of that pay and chase model. Now we are, in the past couple of years, really focusing on data analytics and how we can detect things earlier. In terms of detection, we have a zero tolerance approach for fraud at the department, and we've got new data analytics, some of which we got funding for last session, some of which we'll talk with this committee about in the coming weeks, hopefully related to governor's budget recommendations. We've also done, and we will be doing more, unannounced site visits for the high-risk services. I've noted earlier, but we do administrative enforcement at the department, so we are not a law enforcement agency. We do collaborate with law enforcement, but what we can do is investigate and institute payment withholds. So you can see since 2020, we've conducted over 3,000 investigations and referred over 500 entities to law enforcement. So that would be our Bureau of Criminal Apprehension, the Attorney General's Office, the U.S. Attorney, FBI, other federal partners. I mentioned the collaboration with law enforcement, so I'll breeze over that slide and just get right into some of the implementation updates, looking at the time here. So some of these updates I wanted to note weren't in the committee's jurisdiction, but certainly when it comes to behavioral health, that's an integrated service. So I think it's just of interest and hopefully of interest to members. There were changes last session as it relates to substance use disorder, quite a few changes. We made a change related to what's called the midpoint billing rule to really clarify that providers cannot double bill within the same unit. This was a federal law and requirement already in place, but there were some issues that we were seeing, especially as it related to kickbacks or illegal remunerations, if I'm using the legal term. Last session, the legislature, so just to be clear, that was more of a policy change. We've updated all of our provider manuals. We've trained providers in multiple venues, sent notifications to the providers as well, and of course, worked with them throughout last session to make sure they were ready to implement and enforce that change. With regard to recovery residences, we made a lot of changes and reforms. There was some of this work started in 2023. Senator Abler was a champion of this work in particular, maybe others on the committee. Sorry if I'm missing anyone here. Senator Hoffman, who's no longer on this committee as well. But we made more changes last session. So we brought forward some proposals to make sure that recovery residences, formerly known as sober homes, are certified, that they've got appropriate protections in place for people, but also requirements and how they operate. And then we made some changes to how room and board was paid for, and allowed those residences to be able to access housing support, to clearly delineate between potential Medicaid funding and using that funding to offer someone a housing voucher, for example, which could constitute a kickback under now current state and federal law. So we are developing the standards for this, and we've got a web page going. We're drafting an RFP for a vendor to create an online portal. We also have a work group that's happening with these residences, so there's a lot of activity in that area. I wanted to assure you that that's occurring. Related to MA recuperative care, this is a benefit that helps people who are in need of housing and shelter when they are recovering from a pretty serious illness or potential surgery or something like that. So last session, we worked with the legislature to institute a pre-enrollment risk assessment. This has been implemented over the past summer, and it's happening currently. Given the time, I'm going to skip over the next two slides, but feel free to ask questions or reach out to me after committee. I did just want to touch on a few things here. So the prohibition on illegal remunerations, also known as kickbacks, was passed last session. That is, I mentioned it earlier, but effectively incentivizing or offering someone some kind of monetary or other kind of incentive to get services from a particular provider is what a kickback is in a very simplified, non-legal way. So that was something that our Attorney General's office and others were finding without that crime in state law was challenging to prosecute. So that passed, it's been implemented. Last session, we also got authority to share more data, including claims data with state and federal agencies. This is in the limitations on the use of public funds statute. We've already been using this with other agencies and have a lot of processes in place in the department and across the enterprise to do more of that work and make sure that we're alerting our partners when there's issues with our grantees or Medicaid providers. We also lifted the statute of limitations on surety bonds to make sure that we could collect on those. We were having some issues with the language as it was drafted in current law. So we're now able to get those surety bonds when we need to, when there's been an issue with the provider. Lastly, there was a lot of licensing changes. This is a very simplified preview or overview of those, but we've got the legislature passed authority to deny licensure for applications or temporarily suspend a license for providers that were the subject of a pending action. So it could be a civil or criminal action. We've operationalized this change already. It's fully implemented, very appreciative of this new language that many of you worked on. We also passed an EIDBI provisional licensure last session, which was long overdue. And that is in the provisional licensure we've started to accept applications, and we will be doing that through the end of May, I believe, and then providers have through the end of May to submit their application, otherwise they can no longer provide EADBI services in Minnesota. We will also be coming back in 2027 and are currently developing a full comprehensive licensure for that service. Related to that, there's an enrollment moratorium for EIDBI, so it's just the current providers that want to continue to provide will be able to submit their application that we'll consider for provisional licensure, but right now there is a moratorium. And then lastly, there's a temporary licensing moratorium on home and community-based services, which is an authority that the last year's legislature provided the commissioner at their discretion to implement. And so we have implemented that and notified the legislature as well. So that is very much in a nutshell my program integrity update, Madam Chair. I'm happy to answer questions or meet with folks offline too if you need to get to your bills.
Yeah, thank you. I really appreciate your going through it quickly, and apologize for that need. Members, are there any super high importance questions that you wish to ask? And otherwise, I would ask if you could take them offline to the department. Senator Liskey.
Thank you, Madam Chair. Madam Chair, Director Grom, I guess the main question that's been bothering me since the interim is how we went about selecting Optum as the oversight. I've had issues with them in the past. I know that they hold some pretty significant Medicaid fraud claims against them in the past as well. And so just high level, I guess, how did they go about selecting Optum as our oversight? And then, how do they actually play a role in all of this?
Ms. Grom, I think it's a fairly broad or fairly long question to answer. You can give us a high-level summary, and then perhaps there's other information that can be provided about that whole process for prepayment review and the vendor selection. Ms. Grom.
Madam Chair, Senator Liskey, yes, there are a lot of questions around the prepayment review process and in particular the vendor selected. We can come back and provide a longer presentation to this committee or also sit down with you and give you more detail. But what I will say is that the legislature authorized prepayment review last session. And we, through our data analytics that we have existing right now in the department, we're finding very concerning patterns and credible allegations of fraud. And we needed to do something quickly to stop that. We could not let fraud continue to go out the door. We looked into, I think there was about 4 different provider or entities or vendors that potentially were able to do this kind of work for the state. And Optum was the entity that the commissioner selected because it was the only one that was able to do it on the timeline that we needed. I will say that is a year contract, I believe. We will be looking ahead to future years to, if we are able to get the funding needed, to issue an RFI, a request for information, to have a more competitive process in the future, to look at other vendors and different ways to do this work. I think we've made headway, but we are learning things in our current process, and we'll continue to do so, and would like to engage with you in the legislature more as we move forward.
Senator Liskey.
Thanks, Madam Chair. I guess the other concerning thing that I have is that we have a report, but it's pretty heavily redacted. And so do we have a timeline on when that'll be released? The unredacted version, so that we can actually read and understand what's going on?
Ms. Grom.
Madam Chair, Senator Liskey, the report is redacted by our legal counsel, and it was redacted because the information contained in the vulnerability assessment in particular is classified as, by statute, I think it's section 13.37, is classified as security data. We had a very small amount of time to look at that report. I think we got the final report at 1 in the morning, and we had to get it to CMS 4 hours later or something like that, or 5, maybe 6. So our attorneys worked very quickly on that. We have since taken another look at that report because we've heard your criticism, we've heard your concerns, and we do want to be more transparent to the extent possible. And our attorneys have taken another look at it to see, is there anything that we redacted that we could unredact and share with the legislature? So we've done that work, and frankly, there wasn't a lot that we found that could be. However, we are in conversation with chairs about what we can do to potentially share more information in a confidential way. We have shared the full report with Auditor Randall, as well as the Centers for Medicare and Medicaid Services. So the goal is to be transparent while also not giving fraudsters a roadmap to do more harm than they already have. We are very acutely attuned to the fact that people are trying to exploit our system. So we don't want to withhold it from you all. We want to make sure that we get you the policy recommendations. And I look forward to more conversations on it.
Thank you. And Senator Liskey, that, I know this is a topic of interest and for the Human Services Committee and our committee, and it really needs more time to flesh out. I do have thoughts as well about, what we should try to glean from vendor-supplied reports, and want to be able to provide an opportunity to have that discussion. So this isn't the end of that, but I do really want to move to our bills on the agenda. Did you have another comment? All right.
Just briefly, thank you, Madam Chair. I guess the last concern I have is just timeline, right? The faster we get this done, the better off we are. So I like the to be determined with a little asterisk next to it, but we do kind of need to keep going, and give more of a set timeline would be preferable. I understand we don't have that today, so thank you.
And I definitely agree. We have a very short timeline to get through the process of deciding on what recommendations we want to move forward, and that will require understanding some of the recommendations from the report. So thank you, Ms. Grum. I really appreciate your time today. And with that, we will move on to our bills on the agenda.
Thank you, Madam Chair,
Thank
members.
You. And we do have a quorum present. I wanted to make sure and announce that. Members, we will now move to Senate File 42. Senator Kunesh. Welcome to the committee, Senator Kunesh, and I believe you have two testifiers. If they could come forward at this time. I have Beth Seidel and Jennifer Cordes.
Yep.
If you could come to the table as well. And I would ask that Senator Kunesh and the testifiers, if you can be really succinct and try and each present, if you have different information, and because we were very limited in time today. So,
Got it.
Senator Kunesh.
Thank you, Madam Chair and members. I have Senate File 42 for you, but before we begin, I do have an A2 amendment that just corrects the date. It changes 2026 to 2027.
Thank you. Senator Mann offers the A2 amendment. This is this has been before other committees. It does just update the date. Any questions about the amendment? If not, all those in favor, please signify by saying aye. Aye. Any opposed? The amendment, the A2 amendment is adopted. Thank you. Senator Kunesh.
Thank you. This bill is a request for funding and appropriation to look at suicide prevention curriculum in our American Indian youth population. Just a little bit of background. Suicide is on the rise in Minnesota, and more prevention services are definitely needed, especially for teens. In the past 20 years, the number of suicides in Minnesota have steadily increased, mirroring patterns across the entire United States. Suicide is also on a rise for youth specifically. Suicide is the second leading cause of death among young people ages 10 to 24 years old in the United States, and they've been rising for a number of decades. Most importantly, for this bill specifically, we know that our North American and Indigenous people are at high risk of experiencing thoughts of suicide and dying by suicide due to the history that we have here in the United States. And so this request for a grant would address suicide prevention and mental health wellness curriculum for Indigenous teens here in Minnesota. It is much needed to undo the historic harm and the current pressures that our kids are under. It also encourages traditional ways of healing, reduces shame associated with mental health concerns, and is facilitated by culturally relevant efforts, professionals. And so that is this bill. And with that, I will invite the testifiers.
Thank you. And first, is it Beth, is it Seidel?
Yes.
Okay. If you could please state your name for the record and begin.
My name is Beth Seidel. Bonjour, good morning. Thank you for having us here today, Madam Chairman, and everybody else. Again, my name is Beth Seidel. My pronouns are she, her. I'm White Earth Band of Ojibwe, and I work at Division of Indian Work as a Be at School attendance liaison and not a number facilitator and trainer. In December of 2020, I graduated from Metro State University with a Bachelor's of Science in Human Services. I'm currently a graduate student at Metro State again, pursuing a Master's of Science in Co-occurring Disorders Recovery Counseling. My graduate program will allow me to become a licensed alcohol and drug counselor and a licensed practical clinical counselor, so that I can work with Native youth that are experiencing mental health issues and substance use disorder. I'm a two-spirit person, and for those that are not aware, that means I walk in both a masculine and feminine spirit. I met my wife in 2009, and in 2016, we got married and had the best wedding ever. I lead with these facts because if things had turned out differently, I would not be sitting in front of you today sharing the life that I currently have. Okay, try and do this. Because when I was 17, I had planned to die by suicide. I had come out when I was 17. It didn't go well at all. There were a lot of questions that I couldn't answer, and the non-answers were not appreciated. I wasn't able to answer like, well, how do you know? I don't know. I can't give you an answer. There were other things. There were safety concerns, but none of those safety concerns surrounded me. It was more, have you told anybody? Does anybody at school know? Do your friends know? What if something were to happen to our home? They were all external concerns as opposed to like what would happen to me if something were to go horribly wrong. Because of that and because of the stress and me thinking I did the wrong thing, I had put a plan in place, and I'd gone down to my room and I tried to execute that plan. Obviously, again, I'm sitting here in front of you today to have this conversation so that we can ultimately get money for this curriculum so that other Native youth in our community don't have to go through those same things, even outside of coming out, right? It's been a difficult road, but here I am. And I will say, if anybody has any questions, because I know we're tight on time, can reach out to like Senator Kunesh or myself or anybody else that's working on this curriculum, and we can answer more in-depth questions that you would have.
Thank you. I appreciate your sharing your story and how important this would be to you and others. And now we have Jennifer Cortes, and if you can keep the testimony as concise as possible, I'd appreciate it. Thank you.
Yeah, of course. Hello, everybody. Bonjour. Good morning. Meno Gijigad, Hanihani Washte. I'm really grateful to be here. Actually, recently somebody had told me that if I don't tell my story, that somebody else will tell it for me. And so I feel really blessed, and I feel really grateful to be here and being able to talk to everybody and alongside with you guys. You guys are really cool. And there's a few things that I do want to say is that Native Americans only make 1% of the population, but I think we have 40% of the suicide rates. We are 40% of it. And so I think like that kind of speaks a lot of volumes within itself, and I don't really need to say much. And that, I think this is the first time I've ever said this, but I've also had suicidal thoughts from when I was younger as well. I'm 21 now, and so I'm still in that statistic of being from 10 to 24 years old, where that suicide is the highest in the rates. I have been able to go into youth schools, and I was asking them questions about opioids, because opioids are kind of taking over as well. And a lot of them didn't know what opioids were, but that they knew that they were bad and that it's a drug. And, you know, there's a lot of fentanyl deaths going on and overdosing. And I just want to bring that into the table because a lot of us die from overdoses. And within my lifetime, I've known a lot of my family members who died from it. And I've also had 5 people in my life already who have committed suicide. And so, I just want to bring that into the table. And I'm really grateful to be here. And I thank you.
Thank you. And members, just so you know, this bill, it was heard in Education Finance, and it was passed to us because of the connection to the Department of Health. But we will be, and it needs a fiscal note. The current, that is not available at this time, but we will be passing it back to the Education Finance Committee for further action that they might want to take. So just so you know, Senator Utke.
Thank you, Madam Chair. And I realize this is I believe, just a grant, but you just covered it briefly, but there is no numbers in here. I think we should have some idea of what the proposed ask is, because, I mean, if we're going to pass it back, we need to vote on it. And, you know, I think it's fair that we have an idea.
I would like that as well, but I don't think we have it. And just to assure you that if it goes back to the Education Finance Committee, if there were an action taken on it, it would be under the Education Finance Committee's budget. It would not come out of the HHS committee budget.
Madam Chair.
Senator Kunesh.
Thank you. I just had a refresh number. It really is a nominal amount of around $180,000 that is going to be requested.
Senator Utke. Any other questions? I'm sorry, Senator Boldon.
Thank you, Madam Chair. I'll be brief. I just want to say thank you, Senator Kunesh, for bringing this bill. It is important. This is important work. And just to the testifiers, thank you for being here and sharing your stories. We are glad that you are here.
Thank you.
Thank you.
Senator Liskey.
Madam Chair, thanks. I just wanted to clarify what you had just said, is that it was going to come out of the education fiscal side, but according to the bill on subdivision 1, it talks about Department of Health and the Department of Health's fiscal general fund. So I'm just trying to figure that out.
Senator Liskey, it would be appropriated to the Department of Health, but that doesn't mean that it has to come out of our jurisdiction's budget. It would come out of the Education Finance jurisdiction's budget. Any other questions? Well, thank you. I really appreciate your testifiers coming and sharing your very personal stories. It does seem like an area where we could benefit from greater curriculum availability, so that all kids could benefit from support. So thank you for presenting today. And members, the motion is that Senator Mann recommends that Senate File 42 be as amended, be recommended to pass and be referred to the Education Finance Committee. Any other questions? All those in favor, please signify by saying aye. Aye. Any opposed? The bill does pass as amended. Senate File 42 is referred to the Committee on Education Finance.
Thank you.
Thank you. And next we'll move to Senator Pappas, Senate File 3587. And this bill, we will be laying over, and there will be a public interest review report coming out from the Department of Health. We've been informed that that should be around March 10th, so then we will have additional information. So I guess today, Senator Pappas, we'd like to hear from you, present the bill, and maybe if it would be possible to limit it to one testifier today, as we will be needing to come back with a more thorough discussion.
Whoever you want to send it to testify, maybe Emily needs to come. Yeah. Good morning, Chair Wicklund and members. Senate, it says House file. Senate File 3587 grants Regents Hospital an exception to the Minnesota Hospital Construction Moratorium, so it can add 85 beds to its inpatient capacity. And you'll hear from our testifier shortly about why this is important. As you may recall, Minnesota Statute 144.551 prohibits hospitals without bank bed licenses from expanding their occupancy absent a statutory exception from the legislature. Even when a hospital like Regents is ready to invest its own dollars to expand access to care, it cannot do so without explicit legislative authorization. And that has been in place since 1984, and the legislature has granted 34 exceptions since. So as Madam Chair mentioned, a proposal was submitted to the Department of Health with the required time frame, and they're working on a public interest review. So I think we can all agree to support Regents Hospital. It's a key safety net and one of only 3 hospitals in Minnesota that is both a level 1 trauma and a level 1 pediatric trauma center, investing in much needed inpatient capacity. So now I'd like to turn it over to Emily Brunberg, who's the president of Regents Hospital.
Thank you. Thank you for coming before us. And if you could state your name for the record and begin your testimony.
Yes, Emily Blomberg. Madam Chair, Senators, good morning. I'm Emily Blomberg, and I serve as the president of Regents Hospital here in St. Paul. I want to start with gratitude to Senator Pappas, chief author of SF 3587, along with bipartisan co-authors Senator Utke and Seeberger, for bringing forward this exception to the hospital construction moratorium to help address our inpatient capacity needs in the East Metro. And thank you, members, for the opportunity to speak in front of you to support this bill, which allows Regents to add 85 inpatient bed licenses, bringing more timely care to the community we serve, including trauma and burn care to Minnesota. I want to start with a quick story about Dan. Dan is a retired Ramsey County Sheriff's deputy. He came to our emergency department with chest pains. He's since moved 200 miles north of here, but after retiring, but he was in town visiting his newest grandchild. I had chest pains out of the blue, and they kept getting a little more intense, said Dan, a 2-time cancer and heart attack survivor. We happened to be right by Regents, and I knew that's exactly where I needed to go. They are the best. I've seen up close the great care that they give to patients. Taking care of so many people day in and day out is incredible. Dan was our 100,000th patient in our emergency department in 2024, and I'd like to say that was an exceptionally busy year, but we've continued to increase. Regents is the East Metro's safety net hospital and level 1 trauma and burn center. We care for patients from across the East Metro and statewide, often the sickest and most complex patients regardless of their ability to pay. We care for the highest amount of charity care in the East Metro. We are currently licensed for 554 beds. Best practice for level 1 trauma centers is to run around an 80 to 85% occupancy rate, and at Regents, our daily occupancy of the beds we are asking for runs around 94%. This means that 2/3 of the days at Regents, we have patients in alternative spaces that could range from anywhere between 1 patient and, as of this morning, 52 patients. This request is not a growth strategy. It's to ensure we have the inpatient capacity to safely care for the patients who are already coming through our doors. The beds authorized in this bill would be used for medical and surgical care and phased in responsibly and aligned with staffing and operational readiness. To be really clear, we are not asking for any financial assistance from the state for these beds, only the ability to increase our inpatient bed capacity. The result is better patient flow, safer throughput, and improved access for the communities that rely on Regents as a safety net and trauma resource. We respectfully ask for your support for the bill SF 3587, and I'm happy to take any questions you may have.
Thank you very much. Senator Abler.
Well, thanks, and I know we're short on time. I think this is a great idea at a time in particular with the risk at HEMC and spreading out the needs. And I just want to commend Regions for actually attending to the needs of their community. I've been frustrated with my local group, starts with a big A. That's closing necessary services, including overnight pediatrics. And thank you for doing the right thing. I appreciate it.
Madam Chair, thank you.
Any other questions or comments? Senator Liskey.
Thank you, Madam Chair. Just one brief question. I'm assuming the answer is yes, but you're well-staffed and ready to handle the increase in beds? I'm just assuming that's where we're at.
Ms. Blumer?
Madam Chair, yes, we would make sure that we are only opening beds when we are operationally ready and staffed up. Good question, thank you.
Okay, thank you. And so depending on how the report or when the report comes out, what we learned from that, we will lay the bill over today, and then we'll see what kind of additional discussion we need to have. Senator Pappas, any final thoughts?
Madam Chair, if you want us to come back, and we have other testifiers that also would be available if there are any questions.
Okay.
But we'd be happy to come back.
All right, thank you. I appreciate it.
Great,
Senate file 3587 is laid over. Next, we have Senator Utke, Senate file 3402. Senator Utke.
Thank you, Madam Chair and members. I've got Senate File 3402 before you this morning, and this bill modifies the definition of medical consultant in the Community Health Board's chapter, expanding those professionals who may act as medical consultants for community health boards. In current law, medical consultant is limited to physicians licensed to practice medicine in Minnesota. This bill expands the licensed professionals eligible to act as medical consultants to the following consultants: Doctor of Osteopathic Medicine, a physician assistant, an advanced practice registered nurse certified to practice as a clinical nurse specialist or nurse practitioner. And with that, Madam Chair, I would like to turn it over to Samantha Lowe from Pine County, who will add a little more information to this big, long, short bill.
Yeah. Thank you, and welcome to the committee. And if you could state your name for the record, please.
Samantha Lowe. Madam Chair, members of the committee, I'll be super fast. My name is Samantha Lowe. I'm the Public Health Director for Pine County. I'm also the incoming chair for the Local Public Health Association, and I'm here to speak in support of this bill on behalf of our members. Just to give you a quick tale, in my department, when our medical consultant retired, we spent over 6 months advertising and reaching out directly to providers. At one point, we actually had a nurse practitioner reach out interested in the role. She was really passionate about public health, really cared about the community, and knew all the ins and outs of how we work. Unfortunately, we had to tell her no, not because she wasn't qualified and not because she didn't care, but because of the statutory limitation. So, by allowing additional qualified prescribing providers to serve in this role ensures continuity of services, strengthens partnerships with local providers. Most importantly, it helps ensure the statutory requirements do not unintentionally limit our ability to provide timely services to our residents. This bill offers a practical solution that reflects today's healthcare workforce while preserving strong clinical oversight. Thank you for your consideration. I'm happy to answer any questions.
Thank you. And members, I think this bill doesn't need to go anywhere else, so I would just say that we would, if after discussion, if we can pass it, and then it could be on the floor, or we could include it in a package later on if we chose to. So are there any questions? Senator Liskey.
More of a comment. I want to thank Senator Utke for bringing something forward. The counties have been very much struggling with heavy mandates at times from the state, and this is one of those statutory mandates that make the job difficult. And this opens it up so that they can at least get that position filled at least a lot more easily, which then reduces the risk of fines, penalties, things like that that may occur if they don't fill that position. So greatly appreciate the bill, and I look forward to voting it to the floor.
Thank you. Any other questions or comments? I will just add, I heard from my local public health director last week on their Day on the Hill that he mentioned that they have had challenges finding a medical consultant, and they're very concerned about the one they have retiring and then having to go through a very extensive process to try and find another one, or a time-consuming process to find another person. So I think this bill seems like a practical way to help our local public health agencies. Staff is saying that one thing we could do is to add language, I believe is what you're recommending, that would state that this bill have an immediate effective date. Otherwise, the way it's written, it would take effect in August. Is that what staff is saying? Ms. Hoffman-Litchi, could you state what, or Ms. Heichel, state what the proposed amendment would be to do that?
Thank you, Madam Chair. It would be after page 1, after line 16, insert effective date, period. This section is effective the date following final enactment, period.
Thank you. Senator Utke, would you like to make that amendment here?
Thank you, Madam Chair. Yes, I would like to make that motion as described by council, that we be effective following enactment. Thank you.
Members, any questions about that? Hearing none, all those in favor of the oral amendment proposed by staff, offered by Senator Utke, please signify by saying aye. Aye.
Aye.
Any opposed? The amendment is adopted. Thank you. Any other final comments, Senator Utke?
No, thank you, Madam Chair. Should I make a motion?
Yes, please.
Okay.
Senator Utke.
I would like to make a motion that this bill do pass and that we pass 2 general orders. And we could have a bill that goes to the floor that we should get unanimous approval on.
Senate File 3402, as amended, is recommended to pass. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? The motion does prevail, and Senate File 3402, as amended, does pass.
Thank you.
Thank you very much, Senator Utke. And now, last, we have Senator Boldon, Senate File 3559. This relates to the profession of dentistry, and this bill needs to go to the Judiciary Committee. So, Senator Boldon.
Yes, Madam Chair, thank you. As you said, this bill is related to the Board of Dentistry. It contains technical and conforming changes. I will not go through the entire list of those, but happy to take questions. It also adds felony criminal sexual misconduct convictions to grounds for discipline and removes some outdated language. It increases the supervision limit in the collaborative dental hygiene section from 4 to 8 hours to improve patient access to collaborative dental hygiene services. It removes some outdated language in the restorative functions section to align with board-approved curriculum. It allows for a reinstatement fee for limited radiology registrants and clarifies the collaborative management agreement section by removing some unclear referral language. So largely just technical and conforming changes, Madam Chair, and do have one testifier.
Thank you. Yeah, Bridget Anderson is on Zoom. She is the Executive Director of the Minnesota Board of Dentistry. And Bridget, did you have additional information you would like to provide about the bill?
Thank you, Madam Chair and members. I don't have any additional information. I did just want to point out that the length of the bill is really due to that change with the Commission on Dental Accreditation. It's a technical change because they accredit dental programs and allied dental programs, education programs. They do not accredit schools. So you'll see that throughout the bill, and that's really one of the explanations for kind of the length of the bill. But I think that it's summarized very well in the research that you were provided in your packet. And then also, thank you, Senator Boldon, for going over some of the talking points. But I'm here to answer any questions that you may have. And we are aware that due to the section on grounds for discipline and sexual misconduct, that it would have to go to judiciary. But I'm here to answer any questions that you might have, or any members might have.
Thank you very much. Members, any questions? Senator Utke, did you have a question? Okay, go ahead. Yeah.
Thank you, Madam Chair. And Senator Boldon, I think you touched on it just briefly, but under Section 7, with the language that's being stricken, what was the reason for that?
Senator Boldon.
Thank you, Madam Chair. Senator Utke, could you give me a page and line, please?
Okay, it's, let's see, page 6, and there's 3 paragraphs starting on 6.6 down through 6.16.
Senator Boldon.
Thank you, Madam Chair. I might phone a friend and ask Ms. Anderson to speak to that.
Ms. Anderson, can you tell us what the purpose of this stricken language?
The purpose of that stricken language is to align with the license by credentialing process that we have in place for credentialing applicants. So it was really because we do not interview and we also do not request records through the license by credential process, and we changed that a few years ago. So what we're doing here is just changing it for specialty as well.
Senator Utke.
Thank you, Madam Chair, and thank you, because that's what I was after for the reason, so thanks.
Okay. Senator Graham.
Thank you, Madam Chair. Senator Boldon, this is one of those rare bills that I don't think any of us had anybody come to our offices for or against, which is really rare. But I thought I read somewhere in one of the notes, would this be the time, I've got a regional dentist in my area that I think there's some limitation on providing free care to medical assistants and or veterans because of continuation of care requirement, right? Is there any place in there in any of the changes that increases any of that or expands that ability to dentists? Is that included in this bill?
Senator Boldon?
Thank you, Madam Chair. Thank you for the question. I don't believe so, as this is largely, technical and conforming, but I'll defer to Ms. Anderson to correct me if that's wrong.
Yeah.
Ms. Anderson?
Thank you, Madam Chair and members. Senator, so the Board of Dentistry regulates the profession of dentistry in the state. So we provide all the licensing, complaints, compliance, and discipline. The Medicaid program for dentistry is actually through the Department of Human Services. So typically when you're looking for policy changes or legal changes related to dental Medicaid, it would go through that channel versus through the Dental Practice Act, which is what we regulate.
Madam Chair, thank you. Probably one area we should get a bill drafted and we get it out there because there's many of them would like to provide more, but with the continuation of care, right, and under normal circumstances are limited to a day, the free care. And they'd love to do more, but I'll put in a bill and see if 3 or 5 days or something works. Thank you.
All right. Thank you, Senator Graham. Any other questions? Seeing none. Any other thoughts, Senator Boldon? Member, and you want to make the motion?
I would, Madam Chair, move that Senate File 3559 be recommended to pass and referred to the Committee on Judiciary and Public Safety, please.
On Senator Boldon's motion, all those in favor, please signify by saying aye.
Aye.
Any opposed? The motion does prevail, and Senate File, 3559 is passed and referred to the Committee on Judiciary. And members, seeing no other business before us today, we are adjourned.